All right, let's make sure to review what punctal plugs we have available for use.
All right, so different things we use in clinic, and all the punctal plugs obviously are supposed to block things. And brief review of the anatomy. As you can see, there is a, in front of my face, the superior inferior canaliculus, superior inferior punctum goes into the nasal lacrimal duct. They are connected, so sometimes you can get reflux if you flush to one or the other. And the puncta itself sits in a papilla that is very fibrous and dense, so that's why it's difficult to dilate.
The whole goal with a punctal plug is now to close the drainage of tears, to try to keep tears on the face or on the eyes a little bit longer and help patients, especially those who are just dumping in artificial tears, and this can keep tears in the eyes much longer. So we're going to look at a few different types of plugs that we use in order of length of time they stay in the eye. That includes our collagen, our BVI extended, Duraplug, and then the more long-term ones as well.
So I tend to use a lot of silicone plugs because they last a long time. Lacrifill can also be helpful and give you a little bit of a longer closure. The collagen come in different sizes in our clinic, 0.2 to 0.4. The extend 0.2 to 0.5. Duraplug, a similar. Parasol only come in three sizes, small, medium, large. So depending on what you want, you start with medium. If it's too big, go small. If it's too small, go big.
A little bit of a closer look at each of those. This is going to be the collagen right here. And you can see those very small inserts that'll just go right in the eye, and this lasts for about 7 to 10 days.
Correct.
I've heard of people use this as kind of a temporary, let's trial it out with collagen. What's your perspective on that?
I like it if the patient doesn't want to come back and they just say, hey, if it works, I'll let you know. I don't like it in patients who I really think will benefit, but it's not on the surface, so it doesn't irritate anything. Here's what the package looks like. These are sometimes difficult to grab because you only have these small little things to pull out on.
So using jeweler's forceps, pulling those out, and those get placed right into the puncta.
Correct.
Another option is the BVI extended. Packaging says it lasts for about 60 to 120 days in some cases, even up to 180 days. And these are going to be placed inside of the puncta. Very small as well, look very similar to a collagen plug, but just last much longer.
Duraplug, also little tiny things. They are purple and they also get placed underneath the punctum. This is what it looks like. And here is the parasol, which is loaded by you onto the inserter, which you can see on your left hand.
That loading is perhaps the hardest part of it, just getting it on the tip. Once it's on the tip, there's this nice injector with a small button. Sometimes the button's black, sometimes white. Be ready with your finger on the button, because once it goes in, you press the button and can pull back on that little tip, which will let it stay in the plug, in the puncta.
This is what the plug should look like underneath the puncta, so hence that little fibrous membrane. You can see it expands underneath. It has a lid on top. This is a silicone plug, and if you remove it, you grab it by its neck, if you will, so that you have less stress on the top.
One other type, also considered a permanent unless it falls out, is the Superflex. We use these quite routinely. It comes in a whole range of sizes, and I love the color coding, all the way from a 0.2 up to even more than 1.2 millimeters in size.
They're very large. Here is an example of an insertion. You put it in. Once you feel a little snap, you make sure that it's in by pulling back a little bit, and then you release. And if you want to flatten it out, retract that little stem and make sure it's all the way in.
Two tips I have is, number one, put that punctal plug very tight on the injector, fairly tight on there. Number two, pull the lid fairly taut so you have that tension from the lid to get it in.
The closer you are to the punctum, the better. Lateral tension is better. I tend to go across the nose to have some stability on the inserter.
Some patients also need these removed. This is one technique worth watching. You can do this, but it's a little risky because you do run the risk of actually tearing the top portion of the punctal plug. That went quite nicely. We can see it in both out of the slit lamp and in the slit lamp view of a removal.
Other way is to grab, as you saw in the previous, insert the punctum or the plug by its neck and pull it out that way. Much more ability to apply force.
That's much more secure to do it that way. This is a particular patient who could actually feel the punctal plug rubbing against the conjunctiva, and the removal is fairly straightforward. As long as when that plug is inserted, it doesn't get placed so deep that you cannot grab the neck, as we talked about.
Lacrifill, a gel that's placed into the inferior canaliculus, and you're supposed to insert about 0.2, which is a lot of volume. It's placed with a little cannula, and that cannula is then advanced as much as possible, and you push in, ideally, or sometimes you could even get reflux to the top punctum.
And you saw that just regurgitate back out. We have a few different size cannulas, a 25 gauge, I think we have 28 gauge also. Any recommendation on the size of the cannula?
The bigger the better. 25, you get more volume and more likely to get what you want in. Now the length changes a little bit. There is variations. The first collagen, as you remember, was about up to a week. The next one is maybe 3 months, 90 days. Lacrifill is somewhere in between. It goes over maybe up to 6 months. And then obviously you have the silicone plugs that can last up to 6 months or longer. We don't know.